Ready? Mm-hmm. Okay, so we're going to do 3 palpations and then we're going to perform 4 or 5 activities. So Aaron, go ahead and just lay on your back. Supine, please. So we're looking right now, we're going to be palpating for the TFL. So basically we're going to look, I like to locate the ASIS, but it's on the anterior iliac crest. And then the IT band, so a lot of times I'll locate the iridotrochanter, so I can really get a good idea of where the IT band's at. We're looking for the belly of the TFL, so I know the distance, and then I would just palpate the belly of the TFL. All right, and then the next is going to be the pes anterior. You have 3 muscles here known as Sargent. The insert here is sartorius, gracilis, semitendinosus. And you can always find, so it's the lateral tibial head and lateral tibia condyle and the fibular head. So I locate, say, a joint line, go down to the condyle, and then it's right below the condyle right there. All right. When you're palpating for the TFL and the pes anterior, that's all the same muscle palpations. You know, you're looking for deformities, tenderness. Does it elicit any pain for the athlete? Lumps, anything that's going to like elicit any of that type of issue, crepitus even possibly, any type of effusion, and then you roll over on your nose. Calm for me. So the next one again is going to be, this one's going to be the biceps femoris, and this is the length of the biceps femoris. So it's going to start with the ischial tuberosity. Aaron's okay if I touch you right here? Mm-hmm. Okay. The ischial tuberosity, and then it goes down. And so it's kind of the most lateral over here. Gotcha. Okay. And what was it for the palpations? Go ahead and go back over. Sorry, a correction on the pes anterior when I was saying earlier about it was the biceps femoris that actually inserts, isn't it? All right, never mind, I was right. Membranosus, yeah. That's what I said. So now we're going to do some activities, pretty much your actions, I guess. First one is going to be the effleurage massage stroke on the vastus lateralis. So just pants, you can still get it. You can use it as a pre or a post event. For a post event, it can just be to help move the fluids out of the area or through the area. That's about it. So I like to, for me, just kind of, you can use minimal lubrication if you need to. But just kind of, almost like the strokes. Not really. You're just kind of feeling to see if there's any knots. Again, watching the athlete's face to see if there's going to elicit any type of pain, or if they're going to grimace, if they're not quite telling you if something's going on. But you're already really looking for any type of abnormalities while you're doing that stroke, just to kind of get that muscle, the fascia to release and kind of let it blood flow back into it. The next one's a petrissage of the calf. Go ahead and go back over. Sorry. And this one's more of like a deeper kneading, and this one's a pre-event. So I kind of, again, you're gonna find that there's knots. A little bit deeper. I'm not gonna go too hard on her calf though, because she's a small little person. And again, it's just like a kneading, and you're just, you might locate a knot. Again, you're watching the athlete to see if there's any tenderness or not. All right, and the last one is going to be the friction massage of the patellar tendon. Go over. Put them on, put it on the stretch on the distal pole of the tiny patella. So distal pole is usually the most tender spot. Go below it, and I'm just moving it. Okay, so friction massage is going to be, post-surgery if they have you scarred. any scar tissue or adhesions to form. Again, it also just allows for to basically prevent or assist with decreasing any type of restrictions that are going to happen within the fascial type area right there in the tendon. So it's going to allow the tendon to open up and get the blood in there to move around. And the last thing, I spin around, open the siphon. So open the siphon. This is basically going to be a part of the start, I should say the start of the lymphatic facilitation system. If you turn your head just like there you go. And make sure you're not too high up on the chin or in there. You actually kind of get down in here. And it's very gently. So it's distal up to the ceiling and pop. And again, it's very light pressure. Opening the siphon just 20 to 25 times. And this is going to allow basically the floodgates to begin to open up for the facilitation process. All right.
Go.
So right now, this one we're going to do a broad plain release for the IT band, and the patient usually should be wearing shorts. But
Sorry.
it's all right. So this one, again, it's not a lot of pressure. It's pretty gentle. IT band, short cancer, and it goes down the length of the femur here. You can see it. So I'll start here, and just kind of gonna play with the skin to see if there's any restrictions. That's away from me, to me, and if I find something, so it's to me, let's say I'll just kind of hold it for a few seconds. Probably hold it for about a minute actually, which I'm not gonna do, but I need that. And then you're gonna change directions as well. So you want to go, you're going, back and forth, diagonal, up and down, and you're just trying to get it to release. And eventually, you'll feel the myofascial actually begin to release, and you'll notice it'll just start to ease and move in the direction you want it to go into. And the thing with this is you want to go in the direction of the restriction. So if it's restricted to me, I want to make sure I'm going to work the skin and the myofascial release towards me. And you have a sideline, and then I use a pillow between the legs just to help kind of relax everything, to put everything in a relaxed position. That's it.